So many people have tried to win the battle of the bulge and they've lost. At her heaviest, Loretta tipped the scales at 263 pounds. She was so frustrated being a size 22 that she underwent gastric bypass surgery. Now, after her surgery, she shed 100 pounds, totally transformed her body, as you can see right here. But since then, she's gained back 50 pounds, and now she cannot take off the weight no matter what she tries. Until today, that is. There's a brand new procedure. It's called Stoma Fix. And Dr. Orton?
This is the Stoma Fix. And bariatric surgery is such a big thing now. Doesn't work 100% for everybody. So this is the opportunity to come back in a second time with a non-invasive procedure. This is actually passed into your mouth through your esophagus.
Non-invasive? No, I'm just kidding.
Well, sounds pretty invasive.
No cuts. No cuts.
But you said bariatric surgery. What is that?
Bariatric just means doing surgery on somebody that is morbidly obese so that they can lose weight. Typically either a gastric banding or a formal gastric bypass. That's what Loretta had. It worked for a while.
The idea is to shrink the size of the stomach so you can tolerate smaller meals.
You pass it through the esophagus into the stomach, and what it does, it actually forms pleats inside the stomach, which what it's doing is shrinking the stomach and decreasing the surface area. Therefore, the filling sensation comes quicker in the stomach.
We want to show you how much weight Loretta lost later in the show. Plus, we'll tell you everything that you need to know to decide if this surgery might be a good option for you.
The reason that I want StomapX surgery is to help me get back on track. I was morbidly obese when I had my gastric bypass surgery. I got back down to average weight, and now I'm looking at myself becoming obese again, and I don't want that. I want to be happy and healthy. I want to not be the fat girl.
As most everyone knows, the battle of the bulge can be an emotional roller coaster. As a doctor, my first course of action is always recommending diet and exercise, but in some cases, weight loss surgery may be the only option. Loretta recently underwent a new kind of surgery you probably haven't heard about. It's called the Stoma Fix, and our cameras followed her into the OR.
Here we are today on the day of my surgery. I'm very nervous, very excited. Can't wait to get it done. Currently, I'm at 218 pounds.
Loretta underwent gastric bypass surgery, and like many patients, she did phenomenally well. But over the last couple of years, she's noticed she's feeling like she needed more food to fill her new little stomach pouch. I performed an endoscopy, and I found out that her stomach, which is supposed to be about the size of a golf ball, was actually about the size of a grapefruit. The surgery entails putting an instrument down through a patient's mouth. That's the inside of the stomach, which is quite large. And then using suction, it pulls a tuck of stomach up into the instrument and then fires a fastener across the base of the tuck to hold it in place. Fire. That's a nice picture of a really good plication right there, that big round pink thing. This procedure has only been done in the United States for a year and a half or so. The risk that Loretta faces if she doesn't undergo this procedure is recurrence of the weight-related medical problems that many obese people face. How many total did we put in? 30. Very nice. We're now finished with the surgery. It looks like we reduced the volume of her stomach by at least 60 to 70%.
Loretta's just 2 months after her procedure with the Stoma Fix. Her Dr. Ellner is with us. I want everybody out there to be reminded of how she looked before she started. Do you want to see her now? Come on out, Loretta. Awesome.
Welcome.
How are you? Doing well, thank you.
I'm gonna have you stand right here.
Welcome, Loretta. You look great.
Thank you.
And you, of course, know you're a doctor. So, Dr. Ellner, how is she doing?
She's doing fabulously well, as you can see. She's beautiful as always, and she's down about 35 pounds.
Let's take a look at Loretta's picture before, and let's take a look at her after picture. Tell us how this got started, how it works, who's a good candidate, all those important issues.
This is a fantastic new instrument. The name of the instrument is the Stoma Fix, so the name of the procedure has kind of taken on the name of the instrument. Basically, it's a means to go down through the mouth into the stomach of a patient who has had a gastric bypass, who has had a little bit of stretch of their gastric bypass stomach, and retighten it from the inside so we don't have to go in through traditional surgery. So that's the key,
that you get a certain amount of stretching after doing the traditional bariatric type?
Not automatically. Certain eating behaviors can lead to stretch of the stomach pouch, and a lack of follow-up from the surgeon can lead to these eating behaviors that then stretch the pouch, and people need a little bit of tightening to get re-control of their weight.
I mean, before the Stoma Fix, what were the options for a patient?
Traditional surgery, very big surgery through a great big open incision.
Okay, you want to show us how it works?
I sure do. This is the StomapX instrument itself. We have some imitation skin that is going to serve as the inner lining of the stomach. So if I could ask you to assist me in this procedure.
Hopefully I can do this for you. So this is the lining of the stomach.
And I would be using suction during the regular surgery to suction up a piece of the inner lining of the stomach.
Correct.
Because we don't have suction on the show here, we're going to use a clamp and push it down into the inside of the instrument. So if you could hold that there. I'll fire the instrument, and it actually fires a little fastener that takes application, or a pleat, like a pleat in a waistband that's too large. And it actually we can actually place anywhere from 10 to 50 or more of these. Loretta had about 30 in her stomach. This is actually a view of 2 layers of pleats.
So this is how it looks after you've placed that whole row of pleating sutures.
Yes, and I place them from the bottom to the top of the stomach around in circles. So instead of having a belt tightening around your waist, it's more like having a corset from top to bottom, really tightening the insides of the stomach pouch and reducing the volume of food that people eat before they feel full.
Is this going to hold this time? I mean, can she stretch again, or?
Theoretically, this could be re-stretched just like a regular gastric bypass. The key is really following up and following instructions. Why don't we ask Loretta, do you plan to regain any of your weight?
No, I don't want to regain any more ever again. I actually have 15 more that I'm still trying to get off.
Follow-up is really crucial. It's the same with the StomapX device as with the regular gastric bypass. It's just a tool. The success of the patient really relies on the patient's ability and motivation to stay with the program.
So, how about complications with this procedure?
The complications or risks are really quite minimal. There are complications, potential risks with any surgery. Anesthesia has its own risk. Anytime you use a needle of any kind, there's a possibility of bleeding. But the only complications or side effects that have really happened in the United States here are people have a little bit of sore throat because this instrument is going through their throat. And sometimes people actually feel a tight feeling in their stomach for a few days until the swelling goes down.
But minimally invasive.
Absolutely.
Very good.
And best of luck to you.
Thank you.
You look great.
Thank you. Thank you.
Coming up, do you know how to tell if your child is at risk for an asthma attack? We'll tell you the signs you need to look out for and reveal more medical advances that can help your family next in Ask Our Doctors.